Hi there. Bloating is such a common symptom. It's probably one of the commonest things I see in my clinical practice. But one of the things I really want to know when I see a patient with bloating is what are the medications they're taking. And many times there'll be a complex interplay of different factors that are coming together to give this symptom of bloating. And it's not always as straightforward as it might seem. So when I talk to a patient, I really want to know the medications. And there's at least five groups of medications which I would want to know about. And sometimes there's other ones, but these five are the commonest. Number one, opiates. All opiates pretty much paralyze your gut. So although they may be very good at giving you pain relief, a lot of patients take them for back pain, for example. Unfortunately, they act on these receptors, the mu-opioid receptors, and that basically paralyzes the muscles. So that can cause bloating, pain, constipation. It can also affect the swallowing muscles, even sometimes the muscles that help your bile duct to drain. The good news, there are medications that may help reduce the side effects of those, and maybe in a future post I can talk about that. The second group, which is becoming more common, are the weight loss medications, the GLP one group of medications, which a lot of people are taking nowadays, like Ozempic, Mounjaro, Zepbound, etc. Again, these medicines are great. They're helping people lose weight, which is wonderful. But side effect of those medicines is nausea because it paralyzes the muscles of the stomach. That's how it works, basically. It can cause you constipation as well. And because that may also give you some abdominal pain and discomfort. The third group of drugs, calcium channel blockers, which are very good for blood pressure. But by relaxing the muscles of the blood vessels, it can also relax the muscles of the gut. Again, that causes constipation, bloating, and what we call distension. The fourth group is a group of drugs called the tricyclics, and generally antidepressants. These block something called acetylcholine. Acetylcholine helps the gut to move, and by blocking that, you get constipation, bloating, and distension. And these drugs are often used for depression, or they may be used for mood stabilization, or even sometimes we even use them in the GI practice. Last medication, something called biguanides, and that's metformin, which you may have heard of. It's a very good drug for weight loss, not as good as the other GLP ones, but also for diabetes. But it can have this side effect of bloating, gas, and diarrhea, which is very quickly reversed. If you use an extended release formation, that may reduce some of those symptoms. I hope you find this useful. If you find this useful, please like, subscribe, and share, and give comments below. Thank you very much.